healthy eating, healthy teeth. Healthy teeth is, you cannot differentiate the dental health from your overall health. You want to be healthy. If you are healthy, your teeth will be healthy, right?
Yes,
And
correlated.
yeah, it is correlated.
Absolutely.
You cannot separate it. I give you one more tip for kids as well. Like, or the kid eat too much chocolate, and so if the kid want to eat 5 chocolate, give those 5 chocolate in one go.
Yes.
Okay, and then make his mouth clean.
Yes.
Make him rinse. Rather than he will take one now, after half an hour he'll take another one. What that will do, that will maintain an acidic environment in their mouth. Dubai with multiple cultures. I know Iranians, they are brushing only one time. That also at night, right? So
Not
different
enough.
cultures, that's not enough. You have to brush 2 times. Okay, because that will form for his lifelong, whether he's going to be scared of a dentist,
Yes.
or he'll be fine with a dentist. You know, that is like, see, I'm saying, and it's already.
I know, and I'm so happy you pointed this out.
Yes. See, chewing gums. If you are chewing the gum only after eating, that's a healthy thing. But eating for a while, that remove all the stick food between the teeth and everything, and on the because teeth surfaces they're not straight. There are lots of grooves and fossa.
Yes.
In which the food will stuck. So the stuck food will be cleaned with the chewing gum. It will clean everything, right? Whatever is
Like a washing.
Yeah.
Hi everyone, and welcome to Unleash. I'm excited, super happy today, and beginning a beautiful February with an amazing guest. And this guest is very special. We have with us today Dr. Nudrat Malik. Hello, how are you today?
Hi, I'm good.
Good.
Perfect.
So, Dr. Nudrat Malik is a dentist in the Specialized Medical and Dental Center in Dubai. She has an amazing experience of over 16 years in different countries, and we're going to dive deep into the importance of oral dental care, and I'm going to let Dr. Nudrat take over the stage. So please, Dr. Nudrat, give us your background, how you began your journey, and your introduction.
Hello, so myself, I'm Dr. Nudrat Malik. I'm a dentist. I call myself dentist by heart and art. I have nearly 15 years of clinical experience, and I have worked across different countries. My journey started being an Indian, and my journey started from India. Then I practiced most of my time in Mauritius, and 2.5, 3 years back, I shifted to Dubai. Since then, I'm working at different locations. Presently, I'm working at Specialized Medical and Dental Center, which is located in Jumeirah.
Amazing. And so, did you always have this vision to become a doctor? Was it like your personal choice? How did you decide to come into this field?
Well, there's a very long and interesting story behind that. So, I was preparing for medical exams, and I lost my teeth in an accident. So I lost my upper front 4 teeth in that accident. So, but that was my very first experience. I was like 19 or 20 years old, and I met an accident. I lost my teeth, and that was my very first experience on a dental chair. So it's not that because of that I become a dentist. No, because dentistry chose me because in India it's very competitive to get to the right medical and dental colleges. So I end up into a dental college because of course I didn't get the medical. But that perception of lying down on a dental chair, how do you feel?
Right.
That remained inside me somewhere, and that's what brings my journey to the level where I am today, because I know how it feels like to be on that chair.
Exactly,
Yeah.
yes. So I want to understand, how is it so important for people to not ignore their dental care? And I know that you are seeing day in and day out numerous patients and seeing their experiences and their pain, and so that's why we are here, for us to understand the importance.
See, so I know dental chair is not a very comfortable chair. Nobody wants to come and lie down on that, right? Whatever is the reason why you don't go to the dentist regularly, most common causes are whether it's painful, you have anxiety to lie down on that chair,
Right.
or you don't have time, you're too busy in your schedule, the life takes over, and you're still too busy to be, book an appointment and take care and think about dental health. Unfortunately, it's never priority for anyone. And the third thing is also comes on, dentists are very expensive.
Right.
So, whatever is your reason, if you don't go for regular dental checkups and for your regular cleaning, yearly cleaning, and all that, you will end up into all of this more. The more you ignore, the cost of the treatment will be higher.
Yes.
The anxiety which you have, maybe that time the procedure will finish in maybe in 30 minutes or less than that.
Right.
But now it's a deeper thing, and now it will take me multiple sittings to do that procedure.
100%.
So
yes.
the time, and of course the time which you were saving for you, because you didn't have time of that 30 minutes, now you have to make 3 appointments back to back
Right.
of a longer time.
So we jumped directly to the question, but please tell us about your experience and how long you have been and in which countries.
Okay. So being an Indian, and my journey started from India. I'm from Indore. So I did graduation from that college, and then I worked in the same college. I did my like most of the thing, my learnings come from that, because I have learned from the standard of dentistry. Like I practiced in a hospital under the right professionals who are the teachers, and you teach you the right thing to do, and that's where most of my learning came from. I worked in different departments. In dentistry, there are different departments. So I have worked in different departments, learned root canals, single sitting root canals, how to do crown, how to do this, that, and then the advantage of working in that hospital was because we were the house surgeon there.
Right.
So what used to happen, the patient used to be divided in the interns and the house surgeon. But the interns, the shift will keep changing.
Right.
So 15 days, an intern started a case, and he did, for example, he did a denture. I hope you understand.
Yes,
what the denture
yes.
is, like the removable one or whatever. So that denture is done by him, but now the patient comes back and it's falling. He says, as soon as I do this, it falls. Now what to do? So what we learn is how to go reverse. What are the problems which patient face after the treatment.
Right.
During the procedure you have learned in the college, but what happens in the clinical practice,
Yes.
what you face and what is the condition.
Is a complete different.
Yes, so that's what my intense knowledge come from there. And then in 2013 I was practicing in Mauritius. I started there my own clinic, and I practiced around 7 to 8 years easily there. And there I did single-handed everything. There was no second dentist. Like, it was not a group of dentists how we are working in Dubai. It was an isolated practice. So you have to know, what if this happens? Like, you are the only one who's going to deal with this. See, in Dubai there is lots of support. I have colleagues around me.
Right.
There sometimes if I stuck in some case, I will have a support.
Of course, you have a team.
Yes, we have a team. So there you have to do whatever you are doing, you have to do it. Deal with it, whatever kind of canal it is. In root canals there are very difficult kind of cases. Sometimes the instrument break within the treatment and all that. That also happens, which you didn't expect it will happen.
Right.
But things happen, So how to deal with that, what you have to do, how to bypass the instrument, how to deal with the calcified canal. All kind of thing I have learned my own and practice.
So you were in Mauritius and then you moved to...
Yeah, and then around 2 to 3 years back we moved to Dubai. And in my Dubai journey I have started my practice with in one of the treatment room in Barsha, at Aesthetic Dental and Dental Center. And since last 2 years I'm with Specialized Medical and Dental Center. In between I have worked, I'm still licensed with in JVC and Barsha, the other two clinics are also unlicensed.
Amazing. So your specialization is in, I know it's consultation and root canal and...
So I'm a general dentist. A general dentist, whatever comes under general, most of the things comes under general dentistry.
Yes.
So except implant and braces.
Right.
These two things I don't do, and for that we have team.
You have
so
a
we
team.
have different specialists. Whether you need a simple clean, you see my expertise comes where my expertise come. First of thing, the right diagnosis.
Right.
And making the patient comfortable.
Yes.
My policy is that if somebody is lying on my chair, they should not get any pain. At least on chair there should be no pain.
Absolutely. And I really liked one thing that we were discussing before, that you treat every patient like your own family.
Yes, absolutely. So see, when it comes to, for example, I don't do implant. But if a patient has a missing tooth, I can convince, a patient is coming to me. Doctors, people have trust on you. You can convince them whatever you want.
Right.
But I will not convince them what I do, but what's best for them.
Yes.
For me, if they come to me, they come with their faith, and it's my faith that I will be just with
100%.
them. Whether it's going on my pocket or not, that's secondary.
Right.
That's very much secondary. But I will tell them the implant is the best option, why it is best, why it's not best. And I will always guide them, and of course then they can decide whatever, I don't want to go for a surgery, and whatever they can decide.
100%.
Yeah.
So I want to know about the fears of anyone having a root canal. Is it like is it painful? And how important it is for them to go through this journey and process before it gets a bigger issue?
So see, once a dental problem will always be a dental problem. So if you want to avoid any consequences, first thing, root canal is 100% avoidable.
Mm-hmm.
If you go for your regular dental checkup, you will have a small cavity that can be filled, will be diagnosed by the dentist, and it will be filled then and there. You need not to wait till the pain comes and now there is no other option but to open the tooth. Now comes to the pain point.
Right.
Now, of course, we are dentists, we are the scary people. Without drills, we cannot work.
Right.
So if I say it will be completely painless and very very pleasing experience, no, it's not a pleasing experience. But to make you comfortable during that journey is my responsibility. And how do we do? First of all, I tell the patient how it's going to feel. Okay, and even without numbing, even to prick a tooth, without topical gel, we are not going to prick.
So all of these cautionaries are taken in consideration. Absolutely. And then only, and of course what needs to be done has to be done. And the most important thing is the awareness and the information and knowledge, and also to seek consultation rather than just using ChatGPT or just a neighbor's advice, because every case is different.
Very true. Every case is different, every person is different. The kind of deposit I'm getting in my mouth, you will not get. The kind of harm it will make to you and me will be different depending on the microflora, because we are, as an individual, we are different people. We are different from each other.
Absolutely.
And for that, maybe the same disease will not give you the same symptoms also, because our body is so adaptable.
Yes.
So regular checkups is the only cure for any dental pain.
Yes. And also, Dr. Nudrat, can you tell us about, like, when people reach 40 or when at a certain age, how regular should they make sure that they have a dental visit? And also, how flexible is your clinic with the payment plan? And I mean, all of this is taken care of. And
so see, anybody who's reaching 40 or regular checkups, there is no age for that, but of course after a certain age you have to be more careful.
Yes.
Because the things are deteriorating. We are all age, and with age everything deteriorates. So a 6 month to a year is a perfect time to go for a checkup and fix it whatever need to be fixed.
Yes.
as you age, your teeth will also age. So if you check your pictures from when you were younger, your teeth used to be whiter, and
Yes.
that's why there is a concept of whitening. Whiter teeth are never out of style; it's always in style, and white teeth looks good on everyone. So with age, it become darker. If you want to keep yourself up, you can go for whitening. If you want to go, you can go for other cosmetic procedures as well. And when it comes to payment plans, yes, we are very affordable because we are in Jumeirah, the clinic Specialized Medical and Dental Center where I'm working. It's in Jumeirah 1, but we are not on Al Wasl Road. We are, I call it's more affordable Jumeirahs,
Right.
where the treatment is affordable. The second thing is that we have 9 to 10 major insurances which we have direct billing. So if you have insurance, dental insurance, you are most welcome. That will be the most convenient thing.
Right.
Anyone, you just have to pay 10, 20 or whatever your term co-payment.
Yes.
You just have to do
Of
that.
course, like every place.
Yes, and apart from that, if you want to go for any expensive treatment, any cosmetic treatments, if you want to go, of course, we have Tabby. We can give you, installment
Flexible,
plan and all
yes.
that. Yeah, of course. Yeah.
Can you share with us a client testimonial, someone who had come, someone who was late in coming, and the way, another experience that you were telling me, where there, literally like pain was saved from becoming a larger issue.
So I'll share you one of the case where it was time restriction was there. So one of my patient here in Dubai, she's from Russia. She's a doctor. Somebody last year did her upper veneer, and the lower one where nobody was touching because the teeth was little crowded. It was not
Got
very straight, not a very
Aligned.
easy case. Yeah,
Yes.
the alignment was not too good. Everybody was proposing her do some whitening, but the color of the upper teeth and the lower teeth, no matter what I will do, no matter how much whitening I will do, it's not going to match.
Yes.
And she was here for a week time, and her daughter seen me somewhere on social media somewhere, and she took an appointment for that clinic, and she came to me and she said, "Can you do this? I read about you that you are a aesthetic dentist. This, can you do this?" And I'm like, "This it is little bit challenging, but let's try." And the other option was that I could have straightened the teeth and then they can go for that. But even if I straighten the teeth, the color of the teeth will never match from upper and down.
And look the same.
And
Yes.
she's like, I'm a doctor. My patient was a Russian doctor. And she said, I can't even laugh properly because I'm always conscious that there is a big difference between the up and down teeth. And she said, I've been to at least 3 to 4 dentists. Or I don't know how many more dentists. She's been to everyone. Everybody say no to her. And I said, okay, let me do a mock-up. We check if it's doable, I'll do that. And same day, I sent the case to the lab. They did a mock-up for us. And I showed her, this will be the result. She said, perfect, fine. I said, the gum is a little bit like this. It doesn't matter. You just give me the right color. Right? The rest I will.
Exactly.
Yeah.
She just needed it desperately.
Yeah. So that was my loveliest patient. And because of the time constraint, and then the challenge for the lab was also the color match. We don't know what is her ceramic color, which recently she like the present color with the yellow base on her teeth. How to match that is another, it's
another
difficult task to achieve. Yeah. But Alhamdulillah, with the lab cooperation, we were able to do. It took me a little longer. Like it took me to send them back and come back and then send them again for the correction and everything. And that day, I think maybe 10:30 in the evening, I reach home because the patient has to fly back.
Oh my God! I think, like you just are so. I'm so grateful that you're sharing these challenges because number one, what like a relief, It's like your entire personality, and then her being a doctor herself, and they are more they're more of a difficult client, to be honest.
But she was so patient, and she's like, being a doctor, I can say you are so patient, you are so nice.
I just want to come to you for my next visit
You
now.
don't even panic even one single time. You are not like, oh my God, what to do now?
Yes,
Like that.
of course.
So I keep my calm and I
The
keep
reason why,
working.
doctor, your reason for being calm is because how you said that you operated a complete standalone, setup in Mauritius, right? And it might seem like an impossible challenge, but actually these are the planting seeds more than the education itself. The experience
For
and the
sure.
pain points that you become,
Yeah, and the good thing was my experience because I'm coming from Mauritius. Most of my patients were expats. So Mauritius is a very small country,
Yes, I
but we
know.
have lots of expats there as well. So since start, I have worked with American, European, France people are very particular. They want this, they want this. They if they say A, they want A.
I
They will
know.
not be satisfied in 8.1 or 2. No. If they say A. So I have since start, and I love those kind of patient actually.
Really?
Because for me it's like, yeah, this is the chance to improve.
Wow. I love your personality because
Yeah.
I have a home renovation company and I know when a client wants this. And some clients, when they are very particular, it's an added stress.
Yes.
So you don't stress at all because
No, I don't stress. I take
that's
it
the
as
experience that
yeah,
speaks.
you see, I take it as a key, okay, something for me to improve. I
Beautiful.
can improve further. So that is
I
why
think your
approach it.
mindset is very.
Yeah, alhamdulillah, that gives me lots
So I think she's the most trusted doctor. I think we all should definitely get an appointment with. Dr. Nudrat, my second question is that
Yeah.
what about gum bleeding? Like a lot of patients there, I'm sure you must be having these,
See, the gum bleeding is everybody takes gum bleeding as it's normal. Little bleeding is fine.
Yeah.
It's not fine. If your gums are bleeding, that is the first sign your body will showing you it's time and go for a healthy gums. Your gums are not healthy and that's why they are bleeding. So in our mouth, what happened? There is always bacteria. It's an wet land, and it's full of bacteria. The bacteria are constantly making plaque on your teeth, and of course, how we all brush, we all know. Multitasking, especially for women, even
Very
my brush is,
negligible.
my tea is on there. I have to get kids ready, and I'm brushing, right? So everybody is brushing in a hurry.
No mindful brushing.
No mindful brushing. And at night, we all know how lazy we are, how difficult it is to get up and brush properly and sleep. So there is always deposits happening in our mouth. The plaque will convert into calculus, and that calculus is a hard layer which normally deposits, and that is the hub of bacteria,
Oh my
which
God.
is lying next to your gums.
Oh.
Okay, and most probably it's on the gums line where your brush is not reaching properly, and that's why there is the plaque layer become hard, and now it's like there is a
The plaque
calculus
is
on
like
it.
that yellow thing, that extra deposits that you can actually even see visibly in the mirror.
It's not
The-
necessary that you are able to see. Sometime when you get up in the morning, you will feel some
Additional layer.
that rough layer on your teeth. That is plaque. It need not to be visible always. It will be visible for few people. It might not be visible for other. But
So gum
you can-
bleeding is not normal. It needs
Not at all.
to be checked Yeah.
Yeah, if that is the first sign your body is telling you, you need to go and have a checkup. That has to be stopped then and there, because gum has extremely good response. The initial whatever bleeding you are having, you go and get a cleaning done. It will be done. The most common cause is the deposits, which have to be removed. Otherwise, if there might be some medical histories, people have another diseases which can,
Like diabetes.
not diabetes as such. For gum bleeding, sometimes some deficiency of vitamin C's and all, and apart from that there could be some bleeding disorders or
They have to check their vitals and blood tests,
of
right?
course.
Iron
If there is no medical history involved, most common cause is the plaque and calculus.
What are the other common issues that your patients come with, so our audience can relate?
The other problems are, dental problems are, the patient never comes with the same symptoms. It's the cavity. The most common cause is cavity or the gum disease. But if you are a smoker, your gum will not bleed. that they will not give you the first sign. For another person who is not smoking, bleeding will be the sign of indication that, okay, if there is a bleeding, I need to go and get my gums clean. But if is a smoker, he might not get the first sign. He will directly get something deeper.
Unbelievable.
Yeah. So blessing in disguise, but
no,
not a
but
blessing.
that is actually very what kind of deep like issues, because now he will not be able to identify. He's probably, or she's thinking that
Yeah, so-
they don't have any issue, but
Yeah, because there is no pain, there is no first sign of bleeding or anything. He will not feel that, but sometimes he will directly get the gum will get recessed, or sometimes he might have a pocket formation around it, which he never felt, and now he feels like the teeth are little not
Wobbly.
wobbly, not exactly wobbly, but not that strongness, and he get pain on biting or something. Like the other issues will keep coming. But because there were no indication of the initial sign, and he never felt that pain, or he or she never felt that pain.
even those who are chewing gum on a regular basis, I mean, these lifestyle habits can make or break.
So see, chewing gums, if you are chewing the gum only after eating, that's a healthy thing. But eating for a while, that remove all the stick food between the teeth and everything, and on the because teeth surfaces they are not straight. There are lots of grooves and fossa
Yes.
in which the food will stuck. So the stuck food will be cleaned with the chewing gum. It will clean everything, right? Whatever is
Like a washing.
Yeah. But if you are doing that for the long time, what will happen? It does. Main thing will be that he will keep on stressing on his muscles.
Yes.
The human teeth, the jaw is made so that the teeth should only be in contact when they are eating. Apart from that, when you are in a relaxed condition, your teeth should not be clenched. If you are clenched, that means your muscles are stressed, and it's not only about teeth, it's the whole musculature. And the joint, the TMJ joint, temporomandibular joint, is what disorders they might end up into those things. Because your muscles are stressed, stress muscle will certainly cause problem to your joints as well. So
And of course, your facial beauty will also be hampered.
maybe you have more
Strong.
more strong muscles, and which will give you more more
A masculine look for the woman. Yes.
certain.
So, what advice do you give to the patients? Like, for instance, if most of the common problems, like, okay, let me ask you one more thing. What is the process of getting new teeth done? Like,
So you mean the smile makeovers, the veneers and all that?
not veneers, like what, like if they want a tooth replacement, or they want like new teeth, or for the old people, if their teeth are coming out, and
So if there is a missing tooth, there are two procedures, whether you want fixed or removable, depending on your budget. If you have a budget, always go for a fix. Never go for removable, because it's more difficult to adjust. There are extra flanges, and it's more difficult to adapt.
to having a cap or a crown.
Cap and crown is generally we put after root canal when the tooth is destroyed with the cavity, and we did a center opening as well. So we put a crown on the tooth. But to replace a missing, you can go for either bridge or implant. If your bone permits, if your budget permits, go for an implant always. But depending on how much bone is left, what is your condition, what is your systemic condition, whether you have diabetes or any other condition involved, that of course will decide whether it will be good for you or not. But if there is a missing tooth, you can go for implant or a bridge. And so that's how the new teeth is placed.
Right.
But there is a missing thing.
Exactly.
We don't. If you want to beautify whatever present is there, you can change the alignment with braces and aligners. Nowadays, aligners is such a comfortable thing. It's an invisible braces. You can do it at any age. It need to be, before it used to be like, whoever is into workplaces, we professionals, we don't want to put braces, right?
Right.
For all the professionals, that's the best thing to put a liner. It's like a plate. It will be
Cover.
it will be like a transparent plate. But of course, you have to wear it for only while eating you can remove, rest of the time you have to put. But for example, you are doing a podcast with me and you don't want to continue that, so you can just remove for 2 hours and then you can put it back.
Right,
So
right.
it's very comfortable.
It's the new thing. I see everyone has utilized this facility, right?
Yeah. It is very convenient, and in terms of not cheaper treatment, but of course we make it more affordable by giving the payment plans and all.
Also, I want to know about the new technology and how we are lucky to be in a place like Dubai, right? We have good, sound, research-backed systems, machines, appliances, doctors.
So I think since I came to Dubai, we do only digital dentistry. So whatever new crown, bridge, veneer, whatever you need, implant placement, full dentures, whatever you need will go through a digital scanner. We know more put the material inside the mouth and all that. So of course it's convenient, and how do you say, that is the accuracy is also increased.
Yes.
So before we used to get one time the crown will come and then we have to send it for adjustment again and all that. That has been reduced to very small percentage. Most of the time we don't have to send it back and all that, which increase the precision of overall.
Yes. And what about some people, they have dental anxiety, right? So how do you help the patients get on with this important procedure and not delay it further?
See, people, I have dealt with all kinds of anxieties. With kids also we have dealt with. I think my husband is the worst. He's the most anxiety about dental treatment. He's my worst patient. But for anxiety patient, the one thing is that one of my patient, I remember in Mauritius, when she used to come, she's like, even if you're touching, she was like, she'll be like, what you are going to do? I said, are you getting pain? So she's like, I'm not getting pain, but I'm very afraid. So she doesn't want to hear any drill or anything.
Right.
So she used to put her music in her ear, and every touch will be like this. I said, okay, calm down. So my approach is like, I go with the how the patient is accepting.
Right.
First of all, it's very important for them. Not everybody have same. Everybody is different, so you have to deal differently with everyone.
Yes.
So you have to go a bit slower to them. You have to do, for example, even the kids come. So we do a procedure which is not at all painful. It will be a fun for them.
Wow.
So just to encourage them.
This is so important, right?
So for me, it's very important that, especially when a kid is coming, especially a kid who has his first consultation, first time he's coming, I'm his first dentist. That is my biggest responsibility.
Beautiful, yes.
Because that will form for his lifelong whether he's going to be scared of a dentist or he'll be fine with a dentist. That is like, see, I'm saying, and it's already.
I know, and I'm so happy you pointed this out.
Yes.
Because this is where the fear comes from.
Yeah, exactly.
A bad experience, a painful one.
Bad experience, and also, this is my request to all the mothers as well, that stop. Oh my God, dental treatment. Oh my God, you are going to have pain. Don't talk all this to the
kids.
Especially when they are going to a dentist. You have to make them. It's very normal. There is no pain. We are going to the best one. Like you have to build that rapport.
You have to
first. Yes. Then only they will be like, yeah, okay, fine. And then it will be my responsibility to make them comfortable.
Exactly, but
and then every age you have to say different things. Like for example, if 3 to 5 is coming, you just have to, oh my God, how old are you? Oh my God, you look like a big girl or a big boy.
Yes.
So you have to, it's being dentist second, but first you have to be a psychologist. You have to deal with making them comfortable on your side. That is the most important thing.
And I really admire your mindset because, and honestly, I think I feel we take it for granted. Right? And as we age, we value beautiful teeth. And why wait for this stage when things become, difficult to manage.
Exactly.
And maintenance, now medicine is about maintenance, preventive, right?
Very true.
We have to bring more awareness in schools or within women communities or meeting groups even, that have you checked or have you had a follow-up checkup?
So see, this is my approach. Uh, it's important for now how the market is shifting. That is another aspect. But whenever I'm free, if I'm not doing a patient, I'll be making an educational reel on my Instagram.
Absolutely.
I have around 400 plus reels on Instagram, only about dental. If you want to hear about dental,
can you also, again,
Well done.
we will have it in the captions, but what's the
Sure.
handle?
so Dr Nudrat.dentist is my Instagram handle, and you will get all kinds of reel. And there is no systematic, there is no system. Most of the time, I'm very random. I will go, like for example, I faced this issue today. The patient was asking me this. He didn't know about this. So on that day, I will just make a reel on that.
Amazing.
That's what, like,
Yes.
that's why it's very,
It covers all facets.
Yeah.
And that's how we met as well, at the doctors conference.
Yeah,
right?
yeah, exactly.
And that
Yes,
is
yes,
when
yes.
I just said that we need to have like a proper understanding for the audience on, we neglect this and this should not be neglected at all.
Exactly. And I keep doing many corporate talks as well. I'm like, wherever there is anything, are you available? I say yes, I'm available. I will come because I love to educate. I know, because the people blame you. My market is bad. This and bad. This and bad. I say no. So whatever is the condition, how are you going to break the cycle?
Yes.
What can you do from your side?
Absolutely.
Go and educate people. The people are staying. The people who have insurance, their insurance is
Wasted.
because they are not able to use it. They don't even have awareness. They have everything, but they don't have time. More than time, they don't have awareness.
And this is also like a kind of a misconception from the beginning,
Very true.
that dentist facilities is expensive, or I don't know, painful or not needed, can be avoided. Well, it can become your biggest issue if
Yeah.
not dealt
So
promptly.
I tell you, it's every individual. Most of, like, I will say, especially all our desis are like this at least. They will keep a pain for 3 days in their mouth.
Yes.
And therefore they are like, I cannot bear. Can I see you right now?
They wait for the complete when it's.
Yeah, so it's always in their mind that maybe it will go.
Yes.
But dental, the teeth are very different from rest of our body. The teeth do not heal by themselves. If you are not treating, it's going even deeper. And there might be a time that now the tooth has stopped paining, but do you think the problem is gone?
No.
It's going under the bone. You get
Oh
an
my.
abscess in a bone. Sometimes you get space infection. The whole side is swollen, and sometimes people can even die with that.
Yes.
That can also happen. But that is very extreme condition.
But I'm
May
glad you
nobody
pointed
do that.
this out, because this is the lack of prevention that can we cause the
Exactly.
issues.
And because now there is no pain, the food is still going in that teeth, but it's no more hurting or anything. So I don't want to go to a dentist. And you're keeping that teeth thinking ki it's gonna be okay. No, it's going to be worse.
And it's going to rot the other ones.
It's not going to stop. Dental problems, we are meant for a reason. God will make us for a reason,
And every like our teeth, they're here for a purpose, and we need to respect our blessed
For sure.
teeth and take care of it.
Of course. See, dental health is anything which is, if you have a dental problem, the bacteria is starting from your mouth. Anything you will eat, do you think you will be not see the consequences?
Exactly. Then you'll have digestion issues.
It's not about digestion issues, but it might cause it is related with heart health. The bacteria in your mouth is being related with your heart health. It has been even now, even I'm the research is still going on, and I will see more correlation between so many systematic diseases which is coming because of this, because of the oral hygiene. People have higher chances of getting heart attacks. People have, I think it's been correlated with Alzheimer's as well. The researches are still going on that it might cause that as well. There are the correlation of the same bacteria, which is normally a harmful bacteria causing you a gum problem or a cavity, is present in rest of your body.
Oh my, this is so good that we are discussing it, because see, some people are too, but you cannot be oblivious, and I think the government is also doing a lot of awareness campaigns, but I feel it should be more. It
What
should
I
be.
feel like it's an individual responsibility. Everybody
Yes.
must do it.
Right.
Whatever level they can do.
Yes.
I would love to go for even for a education camp. I love going and doing a dental camp for kids, where we sit down and we educate the kids.
Right. Doctor, makes me want to ask my next question about how many times, I know it's 2 times, but like the normal, like routine care, how many times should we brush our teeth, floss, and
Yeah. So
foods to avoid?
yes. So see, foods to be, of course, we all should eat healthy foods. That is, everybody knows, right? There should be less sugary things and more healthy things like fruits, vegetables, more fiber in your teeth. What is good for your body is good for your teeth as well. As simple as that. Okay. So this is about food. What you have to avoid. The kids can avoid more sugary drinks as well. If they want to consume a juice rather than juice, eat a fruit. That is more healthier and better for your teeth as well, right? So this is about the food. About your regular, see, a dentist cannot do anything if you are not brushing. The thing has to be done every day by everyone.
Right.
So 2 times of brushing is what the most recommended thing you are supposed to do. Use a soft to medium brush, not a hard brush, and you have to do more than, the technique is more important.
Yes.
So it has to be a round circular technique.
And the bristles should be medium.
It should be medium to soft.
Not hard, yes.
Yeah, it should not be hard. I know, but the people who use a hard bristles, they won't get satisfaction with a soft one. That's why I always say it has to be soft to medium.
And you should use other things like the tongue scraper.
Yes, tongue scraper, if you are used to that, do that, because that is the reason for most of the bacteria will stick on your tongue, so it has to be done. And apart from that, if you are a flosser, that is the best thing you can do, because flossing will clean between the teeth where most of your toothbrush will not, the bristles
Yes.
will not reach. So if you are a flosser, that is the one of the best practice. I know if you talk about desis, it's for us, we are never used to floss. Right?
Yes,
We were never a flosser.
it's a new, yeah.
It's a new thing for us to adapt. Me being a dentist, it took me also longer to get adapted to that.
But but another old thing I want to remember is like, how in the Arab countries also they use a miswak.
Yes.
And there's a reason for it, because I mean the importance of dental is there, but it has not been tapped as much.
Exactly. See, if Quran is mentioned about miswak, he had mentioned anything which is being mentioned, it must be necessary or
Yes.
important, so important, right? Now, in toothpaste and toothbrush, of course, a toothbrush is more important, and that's why the miswak is what?
Yeah.
Like mechanically removing the
Yes,
hair.
at that time that was the thing available.
That was the thing available, and of course, miswak, you cannot make with any. It can't be from any tree. It has to be a particular tree which is coming from.
Yes.
So of course there is scientific. I'm sure
Backed.
there are more. Yeah, there must be something more useful which is good for your gums, and
But also
it has to be good. It has to be good. But yeah, use it.
Also, I just want to just really, in fact, I'm actually thinking to schedule my dentist appointment ASAP, because, we need these kind of discussions. And honestly, I think, and we have to preventive care is the most important thing. Is there anything in the end you want to share with the audience, or how can they connect with you? And consultation and the advice.
Okay, so my advice is, of course, do brushing. Twice is more than enough. I have seen in being in Dubai with multiple cultures. I know Iranians, they are brushing only one time. That also at night, right? So
Not
different
enough.
cultures- that's not enough. You have to brush 2 times. Okay. I know there are Filipinos whose brush is always in their pocket. Even in lunchtime, they go and brush their teeth.
Yes.
So
I see them in the ladies' room.
Yeah. So they don't need 3 time or 4 time brushing. Brushing is 2 time enough. More brushing is also not good.
Beautiful.
But the thing is that the plaque layer should be out. As soon as you finish eat, rinse your mouth. That is my advice to anyone and everyone.
And also about frequent, like, someone, they love chocolate, right? It's about the timing. Like, some people try not to, once your teeth are clean, right? Give a food break.
So,
give a fast.
Okay. So I give you one more tip for kids as well. Like, or the kid eat too much chocolate, and so if the kid wants to eat 5 chocolate, give those 5 chocolate in one go.
Yes.
Okay, and then make his mouth clean.
Yes.
Make him rinse. Rather than he will take one now, after half an hour he'll take another one. What that will do, that will maintain an acidic environment in their mouth, and they will keep having. So people who see healthy eating, healthy teeth. Healthy teeth is, you cannot differentiate the dental health from your overall health. You want to be healthy. If you are healthy, your teeth will be healthy. Right?
Yes, correlated.
Yeah, it is correlated.
Absolutely.
You cannot separate it. So, if you want stronger teeth, caries-free teeth, don't do that every 1 hour, 2 hour. You are still munching something.
Yes.
Right? That is not good for your body. Also, it's
exactly.
not good for your teeth as well.
Exactly.
So that acidic thing need to be
removed from the system.
Removed. And rinsing is the best thing what you can do.
Also, there is this coconut oil pulling in the mouth.
Yeah. So see, oil pulling is Ayurveda and all that. So of course
that's a separate.
There must be some goodness.
There's no harm.
There is no harm in there. But oil pulling cannot replace daily brushing.
Yes, and cannot replace medical pain issues.
Yes. So all these things are good. Additional, whatever you can do. If you are fine, we are more than fine with you.
One more thing coming to my mind. I think I can go on forever. Lemon drinks. Yeah. Should we sip it with a straw?
So depend. If you are using, see, it's all about how frequently you are taking. If whole day you drink lemon, of course it's not good for your body, and your teeth will always be harmed with anything acidic will harm your teeth as well. But your teeth is enamel, that is the hardest substance in your body, so that is the last thing you have to think of. Oh my god, I'm going to harm my teeth or not? If you are taking lemon continuously, you are already harming your body, right? So everything in moderation, there is no harm.
Right.
Once in a while you drink a lemon drink, there is no
and
harm.
Coffee staining your teeth.
No problem, enjoy your coffee. See, we all need coffee. It works like a petrol for
yes,
us, right? So,
when we're overworked.
Yeah, of course. So
unlimited coffees.
That is our bandage for
right.
Keep working. So nothing against anything that it will harm your teeth. Maybe the teeth can be, it's the hardest substance in your body. So you need not to be, oh my god, my teeth will get.
Well, we've got doctors. We've got the best doctors for everything. So you can relax. You don't need to overthink. And can people get in touch with you via Instagram?
Sure, of course.
But only for dental questions.
Yeah, no problem. Being in Dubai market, you have to be social as well.
Absolutely.
So, but of course, the right social things, no problem at all.
And we have to book a consultation at your
sure. Most of the time, I am my timings are 9 to 5, but I'm on flexible schedules. Sometimes today I'm doing this podcast with Samira. So there is no fixed timing for me. So it's always best that we book in advance so that you need not to wait and I need not to wait.
Yes.
What is your most comfortable time? What is my comfortable time? Let's make and do the appointment.
Yes.
Also, if I do your appointments, keep a good time around.
Yes.
Because I don't want to work in hurry. For me, peace of mind is very important. Don't give me a pressure, oh my god, there's another patient waiting outside.
But you know what? I think the most important thing about a doctor is their nature. And you are such a beautiful personality because you are thinking of everyone as your family. And this is the kind of doctors we need, because sometimes you come across someone who's so mean, and sometimes they are so uncooperative, and they're not empathetic. I had this one encounter, and I've honestly felt like, oof, like, you know, they wouldn't even answer your additional questions. So we need doctors like you, and we have one. So I think we all know where to get in touch.
Sure.
Thank you, Dr. Nudrat.
Thanks to you. Thanks to you.
I
Thanks so
really
much.
had the most amazing, informative, insightful interview, and I think you all would definitely want to have Dr. Nudrat back and at one of the seminars. Let's stay in touch. Please connect with her on her social media platform, and the other links, and the clinic center, medical specialist center in Dubai. You will have Dr. Nudrat, and let's get in touch and take care of your teeth.
Thank you. Thank you so much.
Thank you.